Hi everyone, my name is Yasmin Saibzada and this is my final presentation for Sociology 100. My presentation topic is COVID-19. It's the highly contagious virus that rapidly spread in March 2020 and has killed millions of people around the world. The world went into an intense lockdown, and depending on government responses, some countries were able to lift lockdown restrictions, but some countries like the United States are still struggling to recover because of how they handled the pandemic from the start. The pandemic began during the Trump administration, and he openly dismissed the seriousness of the situation. He did not do anything to protect the country. He simply called it similar to the flu and told people to calm down. His nonchalant attitude about the virus made a lot of his supporters also deny the seriousness of the situation, while thousands of people were dying daily. Since the virus is highly contagious, low-income communities are the most affected. People in low-income communities live in close proximity to each other. Low-income people cannot always afford to take off from work to stay safe or protect their peers, so people want to work sick. Low-income people also cannot afford surprise expenses, so the sudden need for masks, gloves, and hand sanitizer was not easy for everyone. There was a lack of community resources to keep everyone safe, especially early on in the pandemic. This graph from the New York Times shows newly reported COVID cases in the United States. Each line on this graph shows the number of confirmed cases from that week. As we can see, there has not been a single week since March 2020 without at least a few thousand new cases. This winter, we had giant spikes in cases that spanned the millions. This graph, also from the New York Times, showed COVID-related deaths in the United States. April through June 2020 and December 2020 through March 2021, we see large increases in COVID deaths. Just like in the new cases graph, we can see that there has not been a single week since March 2020 without a large number of COVID-related deaths. Along with the illnesses and lives lost as a result of COVID, there are many other negative impacts from the virus. The first being an increase in poverty. The communications officer at the World Health Organization released a statement on October 13, 2020, regarding the impact of COVID on people's health. She said, "The economic and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty, while the number of undernourished people, currently estimated at 690 million, could increase by up to 132 million by the end of the year." A large chunk of the workforce was laid off during the pandemic, and people struggled to make ends meet. Not everyone has emergency funds, and even for those who do, it might not have been enough for them to support themselves or their whole family. Even for the people who still work during the pandemic, the work might not have been able to go remote. People with children had to figure out what to do for childcare since schools went remote. Childcare is extremely expensive, especially for people who do not have money set aside for unexpected expenses. There has been such a financial strain on the public due to the pandemic. The second negative impact of COVID is mental health decline. In mid-March, when many businesses shut down and people began to quarantine, a period of isolation started. Many people already struggled with mental health issues, but being away from human contact for the past year has put a toll on everyone. People who may have had undiagnosed issues started to take notice. People who did not regularly check in with mental health professionals were put in rough spots, especially with the decline in work, so perhaps medications or therapy were inaccessible to people. The Kaiser Foundation released a study on February 10, 2021, regarding the increase in anxiety and depression symptoms between the first half of 2019 and January 2021. The increase was almost 4 times the original responses. Not only do we see that more people are experiencing declines in their mental health, but we also see that more low-income people are experiencing the bulk of the stress due to the pandemic. In this chart, 35% of those earning less than $40,000 a year reported the virus had a major negative impact on their mental health. With all this information, we know that low-income people are being affected the most by the virus, both physically and mentally. The third negative impact of COVID is hate crimes. As I discussed earlier, the virus began spreading during the Trump administration. He put a lot of fear in his followers' hearts by blaming China for the spread. He used really damaging words to discuss the virus and gave his supporters the okay to feed into those disgusting sentiments. He openly called COVID the Chinese virus, among other harmful names. He rallied people to be even more xenophobic, and it stirred up an influx of anti-Asian hate crimes. On May 5th, 2021, BBC News released an article about the increase of racial discrimination during the pandemic. A lot of Asian people are being put in very dangerous situations because of the ignorant blame put on them for the virus. The discrimination experiences range from verbal altercations to physical assault. A few examples of these situations are, for starters, the 84-year-old Thai immigrant in San Francisco who died in February after being shoved to the ground during his morning walk. Second, the 89-year-old Chinese woman who was slapped and set on fire by two people in Brooklyn. And third, the two Asian women who were stabbed at the San Francisco bus stop. A whole group of people are being put in danger for something that is entirely out of their control. Each of the issues I've discussed have been addressed to some degree in society. First off, food insecurity and poverty have been the most responded to by the government. The government has issued 3 stimulus checks so far and provides unemployment checks to those who qualify with additional amounts to help people stay afloat. Also, the government has given out emergency allotments of the SNAP program to those who qualify. Although New York City's public schools went remote for the remainder of the school year, there were school meal center pickups for whoever came to get them. Not only did the government come through to combat food insecurity, people came together to support community fridges. All across New York City, there are refrigerators placed for anyone to drop off or pick up food without question. Those who do not have access to traditional assistance, or when traditional assistance is not enough, people have the option to get food. Functionalist perspective applies here. There was a need for supplemental money when a lot of companies laid off their employees. The government stepped in to help people, but due to the economy also suffering, there was not enough for everyone, or it wasn't enough to make ends meet for those who did receive assistance, especially in larger cities where the cost of living is higher. In my opinion, there should be a budget expansion to help more people and help people more, with a focus on those with the greatest need, which are people or families who have or had COVID, are low income or high risk. The Health Affairs Journal suggested that the 5 steps to combat mental health decline. First, the journal stated that federal and state leaders need to invest in public health campaigns that normalize distress, destigmatize mental health concerns, promote self-care, communicate effective prevention and treatment strategies, and help people access mental health services. Next, there needs to be an expansion of mental health screenings. The vaccine administration aims to vaccinate 70 to 90% of the population, so that interaction with such a large portion of the public could possibly give way into doing mental health check-ins. A third component involves individual efforts to reduce distress, build resilience, and provide specialized support for those highest at risk of distress. The journal urged that we must now invest in expanding our social work, psychiatrists, and peer counselor workforces. Lastly, mental health response research needs to be prioritized. Ongoing research should evaluate screening programs and new and existing interventions at population, organization, and individual levels. The finding on the integration of mental and physical health care during and after the pandemic needs to inform our responses to future crises. Functionalist perspective applies here. There should have been a mental health protocol put into place when going into a national lockdown. The government implementing the shutdown only focused on the physical health and not the mental health so much for the people. As for me, I agree with the Health Affairs Journal. There is not enough being done to combat mental health issues during the pandemic, especially when the numbers are rapidly increasing as to who's suffering. The government's budget should expand to include free visits to mental health professionals regardless of insurance. As for what's being done to combat anti-Asian hate crimes, the U.S. Senate voted to pass legislation meant to address the issue in April. The bill would designate an official at the U.S. Justice Department to expedite reviews of violence and hate crimes related to COVID-19. It would also provide grants for state and local governments to improve their own reporting systems. The bipartisan measure passed 94-1, and the bill is now headed to the Democratic-controlled House, where it is likely to pass. At the state level, California lawmakers allocated $1.4 million to expand data collection, advocacy initiatives, and resources for victims. Conflict perspective applies here. People are being pitted against each other, and it is causing issues for the balance and security of society. Symbolic interactionism also applies here. By Trump calling the virus harmful names and perpetuating negative imagery of Asian people, he conveyed a message to supporters that his behavior is okay and duplicatable. People saw how the most important person in the whole country acted and used that knowledge to socialize with other people. In my opinion, more people, especially people with power or influence, need to openly condemn the anti-Asian sentiments brought about by Trump and his administration. There needs to be more awareness about the crimes going on, and you need to ostracize any peers you hear expressing anti-hate sentiments. You are enabling them if you do not give them repercussions for their actions. As for COVID-19 as a whole, widespread vaccination needs to happen. There has been an understandable increase in mistrust of the government in recent years, so there are many people who refuse to be vaccinated. Some people fear there are tracking chips inside the vaccine. Others are worried that the vaccine went from research to created fully within months, and that the scientists that made it do not know the long-term side effects on people. And others are just worried about some third negative side effect. Regardless, the positive impact largely outweighs the positive negative effects in my book, so I chose to get fully vaccinated and think everyone else should be too. The sooner we can all be protected against the virus, the sooner we can all put the pandemic behind us. Thank you so much for taking the time to listen to my presentation about COVID, and I hope you took away some knowledge from this. Have a great end of the semester. Thank you. Bye.